Thank you, Miguel. We appreciate it. I want to bring in now Dr. Lance Plyler of Samaritan's Purse, Dr. Celine Gounder, a specialist in infectious diseases and public health, and also Dr. Gregory Ciottone of Beth Israel Deaconess Medical Center and Harvard Medical School. Good evening, doctors. Dr. Gounder, to you first. I want you to take a look at this new CNN poll. It shows 81% of Americans believe another person in the U.S. will contract Ebola in the next few weeks. Baltimore Hospital evaluating another possible Ebola case right now. I mean, are we going to see more of this, or are these people going in, you know, because the flu symptoms sound very similar to Ebola? What's going to happen next year?
We will certainly see more cases of Ebola in this country. Now, that's different from whether there'll be transmission of Ebola in this country. I think you're going to see travelers coming from West Africa. I think that's inevitable. It's estimated that at the current way that the epidemic is growing in West Africa, that we'll likely see 3 to 8 cases of Ebola arriving on our shores per month. And the only way to really address that is that we need to be fighting the epidemic in the affected countries.
3 to 8 per month? I mean, that doesn't sound good if you're just listening at home, Dr. Gounder, 3 to 8 per month, and who knows, what happens from there.
Right, right. And I think the CDC has taken appropriate measures to try to strengthen infection control at hospitals. And part of that was identifying not just the 4 biocontainment units, which are NIH, Emory, Nebraska, and in Montana, but beyond that, for example, in New York State, we have 8 hospitals that have been identified as referral centers for Ebola patients. So they've gotten additional assistance and training, and they'll be getting retraining. And I think you're going to see a similar approach in other states throughout the country, that they'll be targeting those kinds of resources at specific referral centers that will be responsible for managing these kinds of patients.
Dr. Ciottone, I want to ask you that. It's wonderful news about the 5-year-old boy that Miguel just reported on. He's tested negative for Ebola now. But again, as I just sort of, said to Dr. Gounder there, this is really part of the challenge, isn't it, with so many symptoms of other diseases like Ebola, people with so many other symptoms, and they're going to think, oh my gosh, do I have this? Do I just not have a common cold or a flu?
Yeah, true. It is a problem, and this is sort of the root of the issue that happened in West Africa, where initially the symptoms were misinterpreted as from something else, let's say malaria or what have you, and really the ability to early detect and contain the local infection, preventing an outbreak, was sort of lost early on because of a misinterpretation of symptoms, and that's going to lead to some of the issues that we're going to face here. That 3 to 8 cases that come, are going to be increasing perhaps as this Ebola infection outbreak epidemic worldwide increases as well. We're going to be seeing, I think, more and more cases presenting here, and there's going to be certain steps that we're going to have to take to identify and contain it.
Hey, I want to get to another question. This one specifically is for you, Dr. Ciottone, because this is just coming in. You work in healthcare here in New York City. This is according to someone at Bellevue Hospital. There were not enough nurses on staff at Bellevue to handle ICU and Ebola patients. So patients in the adult and pediatric ICU were transferred to NYU Langone Medical Center for further treatment. Pediatric patients were transferred today, while the adult patients were transferred over the weekend. They needed nurses, not the space, meaning the Ebola doc is not being treated in the ICU area. That's what a hospital worker with direct knowledge has told one of our CNN producers here. So what does that mean that there isn't enough space? What does this mean for the treatment of Ebola patients or people who are coming to America that may have Ebola? Dr. Ciottone?
You addressed that to me?
Yeah.
Yeah. I don't work in New York. I work in Boston, but I think that one thing that brings out is that now we are doing a pretty good job at treating Ebola and Ebola patients, now that it's a handful and may increase in the future. But if we get to the point where these numbers start dramatically increasing, hundreds, thousands, and perhaps more, that's when it becomes an issue, because our ability then really starts to get overwhelmed. And this falls under the realm of something we call disaster medicine, which I am actually a specialist in. We have to try to look at this as a possible early time in a potential Ebola epidemic in the U.S., and it's the actions that we take now at this early time that are really crucial, so that we can prevent the epidemic from spreading and prevent those hundreds to thousands of patients who I don't think any of us would argue would stress our healthcare system as good as it is.
And Dr. Plyler, I want to get to you for you to respond to that as well, because you having worked with Samaritan's Purse, also worked with Dr. Kent Brantley in Liberia. When you hear news like this coming from the hospital, should people be concerned about that?
Don, good evening. I think I agree with Dr. Ciottone. I mean, I think it behooves us to be as prepared as we can.